man, if they do that in public.
There you go. Yeah,
it's
what
like
we do behind closed doors. You're booking somebody?
Booking. So when you arrest them?
You arrest them. You're booking people?
Booking? No. What does that mean? Booking.
Booking. You're like you're booking them into jail? I don't know. I'm not a cop.
You are listening to EMS with your hosts, Erik Axene and Matt Ball.
All right, so today we've got a kind of an interesting hot topic almost.
Controversial maybe?
Maybe a little. I don't know if it's controversial. Well, probably is controversial. People, it's certainly going to be something new in the realm of EMS.
Right.
So if you like our page, make sure you subscribe. Hit the like button on this podcast if you enjoy it. Also, there's a link to our website in the description box, so check us out online.
Sounds good.
So I guess we would start off with body cameras for EMS. I know that there's been, and we've talked about this before, a lot of cases recently where EMS providers were caught on some sort of security camera, ring cameras or whatever, maybe mistreating some patients, and that's been a real issue, right? Or police body cameras.
Right.
They've been caught on police body cameras, whatever. So I think it's important that let's talk about what are your thoughts on EMS wearing body cameras? I know there is a system not far from here that recently went to wearing body cameras.
Very aware.
So I know with police, when body cameras kind of first came out, the mindset was, which it does, it holds police accountable, right? They're videoing all their interactions. You see all these videos all over the place of, is your body camera on? And from what I've heard, I don't have any data to back this, but from what I've heard from people is that it has actually, it has helped prove the cop's case correct, or that they were acting appropriately in not all circumstances.
Doesn't make the news because...
True. Yeah, it doesn't maybe meet an agenda.
Yeah.
But in a lot of cases, it has shown that maybe the police were in the right. And if they weren't in the right, it has been used against the police, as it should be, right?
Right.
If you're not doing something that you're supposed to be doing, or if you're doing something inappropriate, then you should be held accountable. I think we all agree on that.
Yeah.
So, but I think the majority of the times that there was a lot of people out there that thought, now that these cops have body cameras, there's going to be all these, and that hasn't been the case. They've actually seen that most police are out there doing the right thing.
Yeah.
So anyway, body cameras in EMS. What are your thoughts as a medical director?
Well, if you're wearing a camera...
Were you going to say back when the Earth was young?
No, I wasn't actually, but I could. We didn't have cameras
when
back
you
then.
and I were born?
Well, I think the accountability is certainly an issue, right? The fact that there's still people doing it with cameras on says something.
What do you mean?
Mistreating patients, and they're wearing a camera. Okay. It says something. It's kind of like that.
Yes.
I've been in a public place when I see a spouse getting mistreated by another spouse, and I'm like, man, if they do that in public.
There you go. Yeah.
It's
what
like
we do behind closed doors.
That's right. And so, I have my personal opinion. I welcome the accountability. Right. I welcome the I'm proud of what I do. So put a camera on me. Right.
Yeah. I know I'm doing the right thing.
Yeah. What concerns me sometimes is that things can get twisted and construed and maybe misrepresented.
Correct.
And so that would be a fear. I'm just imagining if in the ER I had to wear a camera when I'm treating a patient or coding a patient or resuscitating a very sick trauma patient.
Yeah.
Sometimes some of the things that are said may sound calloused and
inappropriate to the non-medical person. Yeah.
But some of the ways that we would function at a very high level at our trauma center, there's certain things that are said that may not be understood by the layperson in our treatment of a patient. Not that it's inappropriate and offensive. It's just that there's certain things that are done in a certain way that may, to a layperson, be shocking or seem gross or grotesque or brutal.
Yeah.
But these things are done to save lives. So, from a medical perspective, when you see some of what we're called to do, it may seem, whether it's the breaking of ribs with chest compressions and the trauma of that. There's I think a different level of video content. And I think that the concern for me again would be misrepresentation.
Yeah. People misconstruing what's
yeah,
happening.
yeah.
Especially in the pre-hospital environment where, even you in a hospital, you're still in kind of a controlled environment where, you pull into somebody's house on a rough call and you've got the whole scene to deal with, which can be, and sometimes you have to, in the realm of, sometimes you have family members that are panicking, justifiably so, if their loved one is having a major medical emergency, and sometimes you have to, not forcefully, but you have to be very, very stern and direct, like, hey, you need to get out of here so that we can help your loved one. And like you said, that might be misconstrued as, well, why were they rude to the wife of that one? It's like, well, because they were preventing us from getting in there and helping, the patient. But even if, and I think this is something we're right on the edge of, they're starting to talk about it in EMS. This certainly isn't something that's widely used. But even though body cameras aren't necessarily widely used currently in EMS. And I teach this all the time to our new hires in my department when I'm going to different departments teaching. I tell everybody that comes through our department, you have to have the mindset that the minute you pull out of the station, the bay, if you're on a private ambulance and you're running a call, the minute you are out in public, you need to have in your mind that you are on camera somewhere.
Yeah.
The way that you're driving code, that's going to be caught on traffic cameras. I know our apparatus in my city, we have cameras within the box that are recording everything. So if I'm not wearing my seatbelt or if I blow through a red light and I cause an accident, that's all recorded on multiple cameras, right? You got Ring cameras. Everybody's got those.
It's true. It's a good point.
Tons of people have security cameras inside their house, and I can't tell you how many times I'm working a car wreck on the highway, and people are going by, recording
You're going to be on camera anyway.
You have to have it in your mind in this day and age, which was different than when I started.
Yeah.
You have to have it in your mind that everywhere you are, if you are in public, you are being videotaped for your own safety.
Especially when you're dealing with an emergency. It's one of those scenes that attracts attention, the whole
100%.
rubberneck phenomenon, right?
Yep.
And now it's not just the rubberneck, it's the rubberneck and the cell phones out.
Yeah, we recently had a pretty major accident in my city. And before the units, this is very recent, before the units had cleared that call, I was getting video of the call that had already been posted online.
Wow.
Yeah. So, it's happening that fast.
Wow, that's crazy.
So, I think that again, pre-hospital providers need to have it in their mind. Again, a lot of people think about police and body cameras, but if you're a firefighter, if you're, a private ambulance person running 911 calls or just driving, an ambulance, you need to have in your mind that I'm being videotaped. Yeah. And you just need to be cautious about what you're saying. I'm not saying, obviously, if you're doing the right thing, you're doing the right thing, and we should all be doing the right thing.
Well, you know what? There's another factor here that we haven't talked about that would concern me too. Now, I think as long as all of the legalities are, the boxes are checked there,
right?
But the HIPAA issues,
that was the other thing,
is that could I violate somebody's HIPAA rights, and as complete as this waiver was that they signed, there's always some legal loophole or some lawyer that can nail you to the wall still.
Yeah.
But the other thing is, from my perspective as a physician, I'd be concerned about, it's one thing when I'm booking somebody for them breaking the law or whatever, right?
You're booking somebody?
Booking. So when you arrest them?
You're booking people?
Booking? What does that mean? Booking.
Booking. You're booking them into jail? I don't know. I'm not a cop.
Oh, I don't know.
Throwing the book at you.
I've got a guy who broke the law,
okay,
and I'm doing my job
yeah.
to apprehend them and to.
So in this scenario, you're the cop.
So I'm the cop. I got a body camera on, right?
Oh, gotcha. Okay, yeah.
And
yeah.
Now, as a physician, now this is a role I do know, right? As a physician, there's this patient-physician relationship. If I had to wear a camera, and I'm having a patient talk to me, you're losing some of that confidentiality, some of the comfort in them giving you all the information they need. So that would be something you'd have to be very explicit about, is this, this camera is recording us, but it's HIPAA protected and all this. It's still, you can't escape the fact that there's a camera on my chest.
Yeah.
And I'm asking you private medical information, and you don't know where that information's going. So the other concern I would have is, are we not getting all of the information due to the fact that there's a camera there?
Sure.
It's a very private
Yep.
and a special relationship between a physician and a patient. And I think the same thing between a paramedic or an EMT and their patient. They're gathering information. They see a camera there. It's like, I don't want to tell them that.
Yeah.
Even though it may be pertinent to their care, I just don't want them to know.
Right.
Because of that camera. That's another issue that I think I would be concerned about.
Well, we talked about it recently on one of our podcasts where you were telling a story about a young man that had come in the ER with a very private issue.
Oh, yeah,
and the fact that you really like that part of your job, that people are willing to share things with you. And I completely agree that would probably inhibit some people from, I'm not telling this guy that, not because of you, but because of that camera.
But I still would be a proponent of cameras.
Yeah.
I still would be, only because I think that folks doing a good job have nothing to worry about, right?
Exactly. Yeah.
But I think that the accountability is always good.
Yeah.
I think that the accountability is good. I mean, people should not be able to mistreat a patient and get away with it, right? And having that evidence, I think, could be good. Not an effort to micromanage or catch people doing something wrong, but just as the accountability to make sure the right things are being done. The other thing that I think would the cameras bring anyway, is a negative sense of almost like people don't trust me.
From the patient or from the provider?
No, from the provider's perspective.
Gotcha.
Oh, chief doesn't trust me.
Yeah, we've had
my
that.
bosses don't trust me.
Yep.
They want a camera on me.
Yep.
It's not about that at all. I know that, as we, you and I have talked about this, we're running a business, right? And it's not an issue with us because with our company, we're always on camera. No, but even with our everybody's so committed to our role as creating the best content in the industry, to make EMS education something that's enjoyable and something that really impacts patient care. We're all so committed to that. We don't have to worry about people not doing their job. Right? Just because of the nature of our but as we continue to grow, though, and our numbers are getting bigger, we're hiring new people. When I hold someone accountable and I ask them, hey, how many blah 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 did you do this month or this week? It's not that I'm checking up on them, right? It's more of a how are we doing, like a stethoscope.
Exactly.
Right, and so to me, accountability is a way to maintain expectations, and like we talked about in some of our health and wellness podcasts, left to my own devices, I'm not going to make good choices. Right. We have, unfortunately, a default setting, but by maintaining accountability, we can maintain high levels of expectation. Yeah. So to me, accountability means I expect a lot out of my workers. Yeah. I expect a lot out of my paramedics. I expect a lot out of my firefighters. Expect a lot out of fill in the blank, right? Yeah. Yeah. So that's what accountability is to me. And I think of these negative things we're talking about, they can be mitigated, I think, by communicating with the patient, by doing the right thing. Yeah. One last thing I would say is that sometimes in the legal system, you do everything right. Oh, yeah. And they're still going to find something. Yeah. Yeah. They're still going to burn you. So that is a little scary. Absolutely. Right? Yeah. The other side to the cameras, too, is training. Oh, yeah. I know, like, again, the department I know of that recently went to cameras, they've used some of their good calls as training, and it's real life. Hey, let's watch this video of this call that they had, and let's go through it. We can always learn, and things happen. I would say number one is training. Number two, documentation too. Yeah. Like, what if you went in and be like, oh, did we, what exactly happened? Because if you're in the middle of a code or a chaotic scene and you're working, you might not have remembered, did we give this med or did we get, hopefully you're remembering those things, but things do get missed. We're humans, right? Yeah. Things get missed. Well, having that video to be able to reference might improve documentation because they can go back through and make sure everything that they're documenting is accurate to what the video has. Because like you said, if it gets subpoenaed,
and the written documentation isn't matching, that's going to be a problem, right?
Oh, yeah.
But then again, going through training with new people, you know, being able to show them, hey, this was a code we recently worked. Let's kind of walk through this. And I think that is another facet of cameras that we could use as a positive.
You know, we talked about change behavior in a previous podcast, remember? I think that's part of the problem here, is that cameras are it changes the culture.
Oh, yeah.
It's a big change in culture. It is.
Yeah.
You know, when I played football, I knew that, I don't think we called it this, but I know an NFL team that I like to follow calls it Tell the Truth Monday.
Oh, yeah.
Watching film, I mean, I know that at the games, I'm playing with a camera watching me. I know I'm going to see myself.
Yep.
Right?
And others are going to be.
Yeah, and critiquing every move, every play.
Yep.
But that's the culture of football, right?
Yeah.
You're held accountable. Do I look poorly upon my coach?
Yeah.
Because he's holding me to expectations and I didn't meet them, or I did meet them, right?
That is a change in culture.
It's a culture. And so I don't feel, man, coach doesn't trust me. He's got cameras watching me.
Right.
Well, what's the goal here? It's to win games.
Yep.
And to win games, we want to get better, right? So I think, and I love what you said about training, the cameras should not just be accountability to check up on people. Right? Or micromanage people, or catch them doing something wrong.
Yeah, it shouldn't be a punitive thing.
Right. It should be something that makes patient care better, because that's the goal.
Right.
Just like a football team's trying to win games, trying to improve their offensive output or improve their defense. Yeah. You know, you watch film.
Every day.
Yeah. And so I think having the capability to watch and to have film has multiple benefits. And I think all the benefits, to me, outweigh the negatives, in my opinion.
And that's there's two sides to that. There's the firefighter side, and then there's the admin side. Yeah. And in the fire service, there's this constant battle, between the field and the admin guys, right? You know, and every department's a little bit different. So both sides have to be respectful of that process. The firefighters have to understand, or the EMTs, the paramedics, even if it's private ambulance, and their administration's looking at stuff, they have to understand, okay, this, first off, hopefully that message is communicated clear by their bosses. That, look, this isn't a punitive thing. We want to use this to help train, for us to be better, to hold everybody accountable, which is a good thing, right? Yeah. And then the firefighters need to look at that and be like, okay, they're not doing this to get us all in trouble, right? But then the admin side has to be like, okay, we can't use this to get everybody in trouble. Right? Now, that comes sticky when somebody does something that they shouldn't have done. Right. That becomes a little bit more of the muddies the waters a little bit. But I'm kind of curious. I wonder, what the percentage of people that would actually change their behavior knowing that they're on camera. And the reality is, we're talking about a culture change of body cameras. But again, the reality is that for the most part, when you're out there right now, you are on camera. Yeah. You are on a Ring camera.
Whether you know it or not.
Whether you know it or not, you need to have it. So, again, whether your department's this is even on their radar of doing body cameras, right? Yeah. It shouldn't matter. You need to know that anywhere in this country, if you are a firefighter, paramedic, EMT, in a fire department, private ambulance, does not matter. If you're working a wreck on the side of a road, people are going to be videoing you. Yeah. If you're in a commercial building, a restaurant, a store, something like that, performing patient care, that is all on camera. We all know that everybody's got Ring doorbell cameras, and we haven't, but I've heard of cases where firefighters, paramedics have come out of a house and maybe said something as they're leaving the house that maybe wasn't the best thing to say. Yeah. And that gets caught on Ring doorbell camera. Yeah. Well, that goes right to the family of that patient, right?
That's a good point.
So you got to be really careful, and I think I know that's certainly a culture shift, which, sometimes, unfortunately, in the pre-hospital environment, we have a little bit of a dark sense of humor that is kind of a coping mechanism for us. But we have to be careful because, like you said earlier, that can get misconstrued about what we're saying,
I would challenge something you said earlier, that, I really think the camera would make a difference to patient care. I mean, let me ask you this question. Okay. You're on the box, and you go to your chief's house
How different are you going to act?
pick up his wife.
Yeah, right.
And then you've got Chief in there watching you take care of his
100%.
wife. And I know you.
Yeah.
And you deliver great care.
Right.
And your colleagues at your department do too.
Right.
Amazing.
Right.
I love being your medical director. You guys are your special department. But there's something that happens. I've treated the hospital CEO. I mean, it's like my boss. I checked on him a couple extra times.
Absolutely. That's human nature, I think.
He really, I really do try to take care of every patient as if they're a family member, right? To me, that's my measuring stick.
Yes.
But when that person's there, that celebrity or that, the boss or the CEO or the chief or whatever, when they're there, there is something about, okay, I know I'm delivering great care, but I'm just going to really make sure.
I'm going to go a little extra farther.
Yeah.
Do you want a pillow? Would you like a blanket? Yeah.
So in those situations where maybe it's a difficult patient, right?
Mm-hmm.
So let's go to the other end of the spectrum. Mm-hmm. Do you treat that guy that just spit in your face and is swearing at you, is intoxicated, and, crapped his pants or whatever, right? We've
fighting you.
Unfortunately, not uncommon.
Not uncommon. Not these days.
So when you have that sort of a situation, do you treat that patient the same?
Yeah.
That's another question to ask too, right?
Yeah.
But when you throw the camera into the mix, when you throw the camera in,
You're doing it.
It's a little different, right?
Yeah.
I mean, I don't think you're going to treat the CEO any different if he had a camera.
Right.
I wouldn't. I
But
don't think I could
guy.
deliver any better care. I mean,
Right.
what am I going to do?
Right.
But when you have the
difficult
patient or those patients that
2 in the morning, they're tired.
or
the frequent flyers or high volume user,
the other thing that I think is really going to benefit us as a pre-hospital community are the refusals.
Oh, recorded.
Yeah.
Oh, yeah, for sure.
Because I really believe that we do a much better job on refusals than is documented.
I completely agree.
We did the documentation.
We always do the right thing, but we don't always document everything that we did. I totally agree.
Because, I've read a lot. In fact, I took a refusal MedCom call today, and you were there. You heard me say it, and you heard what I told him to do, right?
Yep.
And is to quote the patient as part of the refusal documentation as to their understanding.
The risks of refusal?
And
if all that's on camera, there's no lawyer can dispute it. And I know there's actually a system around here that actually now does all their refusals. I can't remember if it's recorded.
Do they call it in, or
they have to call it in? And I can't remember if they record it, but they have to call their medical director, video conference call, but for any refusal. So again, I don't know if they're actually recording that FaceTime call or what. But yeah, that's it's proof that
it is
undisputed, right? Was the guy A&O times 4? Did he really understand? Yep, here's the video of it. Yep. Or was he unconscious? Oh, he said he was fine.
And it's not the one-off complaint either.
Right.
We see more refusals than anything else.
Yes.
And so I really believe that we do a better job with refusals than you would think by just reading documentation.
Right.
And 99% of the time you're going to be okay.
Right.
But the most common thing we get sued for is a refusal.
That's right.
And so having that documentation of a video, it's like, wow, I didn't document all of that.
Yeah.
But boy, I'm sure glad I was wearing the camera.
Absolutely.
You know what I mean? I really believe that.
100%. And the other side of that too is, like with the police being falsely accused of something.
Yeah.
I've had, it always makes me nervous if I get, especially a younger female who's maybe having a mental health issue or something like that. I do not want to be alone in the back of an ambulance with a 15-year-old female patient that's maybe that, because that puts pre-hospital providers in a touchy situation, right? All it takes is one accusation of something inappropriate happening.
Poor choice of words, but keep going.
Touchy
situation.
Yeah, no pun intended. It just takes one
I'm
accusation.
just telling you. I mean, really, we've talked about this. The way you put on the EKG leads,
100%.
All that stuff.
Yes.
And we joke around about touchy situation, but one person says he touched me in an inappropriate way.
Bad.
It's
bad.
Even if nothing happened, it's
Correct.
bad.
Yeah.
Right. But with the camera,
you're covered. Yeah, and whether that camera's mounted in the back of the ambulance, a lot of times in those situations, I have done this numerous times, where I will ask, hey, can I take Eric with me in the back,
Yeah.
just to ride back. Kind of like you, if you go into the hospital room with a female and you have to do some sort of a private exam, you have somebody in there with you.
You want to end your career? Do a pelvic exam alone. I mean, that's just asinine. Nobody would do that, right?
But yet that's not the standard of care pre-hospital. I'm not saying we're doing pelvic exams, but I'm saying that it's
I don't think that's a protocol.
I don't think so. Not in my system, it's not. I did have a patient one time and from a car wreck, though, that said she felt like she was bleeding.
Oh, you got to check.
And I'm like, okay. Obviously, I'm looking at him like, well, I'm not seeing any evidence of blood. But I asked her, young girl, like, do you want me to look and check? And she was very concerned that she thought she was bleeding. At any rate, always a good idea. Like I would always ask. But the body cameras, any kind of a camera in there, again, it's one of those things that can protect the provider.
Another layer of protection.
100% of, hey, that didn't happen. Here's the video right here. Yeah. And I think that we would find, more often than not that it's a protection mechanism. Like I said, we have video cameras in our apparatus, and sure, we've had one-offs, where people might, whatever they did, they weren't wearing their seatbelt or something like that, which is very rare in my department. And they get a talking to about it, right? I don't know of anybody that's ever been fired over what got caught on a dash cam, right? Most of the time it's helped. And again, you kind of know, because I've been driving too, and that camera's going. We used to joke about it, like, "Oop, just set the camera off, hey chief," because they're getting an automatic copy of that video. So to your point, you do. It's always in the back of your head.
Yeah, you think about it.
Yeah, that it's there. So it's an interesting topic.
It is an interesting topic, and I think it's far-reaching too. I mean, other professions too. I mean, whether you're an airline pilot, there's accountability there with I think random blood tests, drug tests, right?
For sure.
Yeah.
Yeah, we have that too.
Yeah, but accountability is, I mean, it's interesting that with the police, with law enforcement, it's really, I think that's where it started, right?
I think that's where body cam. I don't know of anybody else that was using those before.
Especially with today's culture. There's a lot of controversial things happening.
And either way, though, I think that whether this becomes a real thing, a more popular thing within EMS, or if this is, not maybe something that's popular, I think that people need to remember that you're on camera all the time. Right. You should have that in your mindset already, whether your department is going to go to body cameras, that when you are in public, you are on camera. Yeah. And the way that you act. Remember that, people call us on their worst days. The way that you're acting is a representation of all of us, right? So if you have that in the back of your head, hopefully you'll...
that's the other thing, too, is you're representing your department, something bigger than you.
Well, you're not just not your department. I'm representing, in my opinion...
profession.
Yes, I am representing the fire service as a whole. So a firefighter in Illinois, if I do something stupid... they're going to be judged for it. Just like a cop in Illinois, it's the same thing. Just like a doctor, if a doctor does something stupid, you guys all kind of feel that, right? Yeah. And so, you should have that in the back of your mind that we want to meet that standard of the respect we have from the citizens. That's a big deal.
It's a high calling.
For sure.
Super high calling.
Well, anyway, it's kind of an interesting topic.
Absolutely was.
Yep. Well, we'll see you on the next one.
Be safe out there.
Thank you for listening to EMS, the Erik and Matt Show.